Now, the ongoing drought has aggravated the myriad of challenges for residents of northern Kenya, literally cutting them off the rest of the country. For them, access to basics such as water, shopping centers, and also health facilities is such toil that they feel denied of a fair chance at life. Here's that report.
To access hospitals, schools, shopping centers, and other such facilities, I would simply walk or take an easy ride to them. But this is not a story about my ease to access such facilities. It is rather a story that is highlighting the sharp contrast witnessed in different parts of the country. Communities in the northern part of Kenya have borne the brunt of the ravaging drought, leaving them struggling to survive. Scarce resources are further dimming the hopes of life for the most vulnerable. The inadequate infrastructure tends to cut off these communities from the rest of the country. As such, hardly do they travel out, nor do aid agencies access the region. Drought that has decimated livestock, their primary livelihood, and dried rivers threatens the existence of the nomadic and semi-nomadic populations. Desperation has driven some of them to eat wild fruits or carcasses of livestock to survive.
Chakula wanawake tunaumuka kabisa, wanawake kwa sababu mtoto anaamuka unajua hata pale unapita unaenda kabisa kama ni bahari nana nakaa huko napatiwa samaki moja. Hii samaki moja hakuna mtu atakula hii samaki. Napatia kidogodogo kila mtu aonje.
Education has not been spared either, with high dropout rates leaving schools virtually empty owing to the unending search for pasture and water. These adversities have escalated poverty in the region to unbearable levels.
Sasa ile siku mtu hauna hiyo shilingi 50 ya kulipa hiyo boat ndo mtoto wako apate kwenda shule, mtoto wako atakuwa anaenda wapi shule? Atakuwa tu anakaa hapa kwa nyumbani. So unapata karibu kwa mwezi mtoto anaenda shule 3 weeks.
And should disease strike, access to the nearest health facility is a day-long trek.
These villagers are a day's walk to a healthy clinic. They are 2 days away from a shopping center.
World Vision Disaster Management Director Gershon Mwakazi says interventions need to be urgently scaled up if households are to be cushioned from this humanitarian crisis.
We have seen women and children eating wild fruit, something that has not been seen for years. And we need to urgently intervene and provide food for this community, cash for this community, multipurpose cash for this community.
Until then, the residents hang on to the thin hope of the heavens to let down the rains. Thin because forecasts already indicate depressed rainfall. Despite these odds, the locals still exude resilience like that of daffodils, hoping to bloom soon after summer. For Climate Centric, I am Teresa Mutai.